Hi, my name is Ginny, and this is Bisaya in America. So the topic for today would be what care in America? So I'm going to be talking about healthcare in America. I'm a healthcare worker in America, and I've worked here for close to 7 years. It's going to be my 7th year, the latter part of this year. And I'm sort of excited, not really, but kind of grateful that I survived because it's really different here. And I don't know if you can hear the noises and stuff, but for some reason, my dogs start eating and drinking and making loud noises when I start recording this podcast. But before that, they're like doing nothing. And then the moment I start recording, they're just doing their thing. So it's kind of annoying. So anyway, I do apologize if you hear any background noise, dogs chewing or whatever. And they may interrupt, which they often do. Because for some reason, they always start making a noise when I'm podcasting. So anyway, so I'm sort of glad that I survived 7 years in America. And I mean, literally, I'm really glad I survived. I had the COVID last year and it was pretty bad. I mean, I didn't get severe symptoms. I got the moderate, but still have lingering effects. So if you have COVID and you're still recovering, it will get better. Maybe, hopefully. But I'm 9 months in and I'm still having symptoms and stuff. Not really bad symptoms, but effects. I can't really explain it. Anyway, so, maybe I can. I don't know yet. So I've been consulting different doctors in America, and I've done this for close to 7 years now, where I'm just jumping from one doctor to the other because I don't know, I don't feel really satisfied that they've really helped me and that they really are trying to help me, because a lot of them, they just take a look at you and then they just decide, yeah, this is what it is and we're just going to do it anyway. But I always say but I still have lingering symptoms. And apparently they don't really care. They just okay, we'll still do what we want you to do. We're not going to listen to you. And it's kind of frustrating, and it's been going on for close to 7 years. And I was lucky when I went to Denver. I actually found she's an internist endocrinologist, and she is a lovely doctor, a lovely woman. I would have gladly retained her. In a way, I have retained her because she can practice in my state, but only telehealth, But I like the hands-on approach. So I might find another primary, or I have found another primary, but I might retain her as my endocrinologist. Anyway, she listened to my symptoms and she just got me, and she said, you know what, this is what happened, when you shift to different generic brands and stuff, they have different doses and different suppliers, so therefore you need a branded medication. And I've been on that branded medication. I've been feeling well and fine, compared to the generic ones, which unfortunately, what she told me was that each CVS, because I came from the Northeast, I lived there for 5 years. So each CVS has different suppliers, and they might say it's 50 micrograms, but it's really not. I mean, there's differences and variances when you move to another state. They have different suppliers, and they use a different generic brand. Or different, I don't know if a generic brand is a brand at all. So a generic something, medication. But she was really good, and I just retained her for 2 years. And when my blood tests comes up, I'm going to retain her again, when the yearly blood work. I've been poked and prodded for so many years now, and I'm just used to it. And I'm nah, just poke me, take my blood, take anything, because I want to just get better. And anyway, so I've been having this weird rash and weird hives. I don't know if it's related to the corona. Who knows, We're on uncharted territory. So since I was like, I went to the urgent care, and they took a look at it, and all they did is pump me up with steroids. So I went to see a primary that was recommended by my friend, and the doctor really seemed intelligent, but what I didn't like was that he just took a look at me. He was like 5 feet away. He didn't even like poke me. I want to be poked. I'm one of those old-fashioned patients that just touch me, poke me, talk to me. So you're standing like maybe 5 feet away, and he just like, show me your rash or something like that. And he said, oh, okay, I know what that is. That's a viral infection. I'm like, oh, okay. So he has x-ray eyes, apparently. So he said, okay, yeah, just pay up, and like I'll give you the medications. I'll send it to your pharmacy, and that's it. I'm like, and he mentioned a condition. I forgot what it is. And I'm like, are you sure? Like, I didn't really ask, are you sure? But my expression said, like, are you sure? Because apparently he has x-ray eyes. So I started antiviral medication, and I think it was the steroids that made me better because, like, as expected, it came back. So I went to another primary because I was like, nah, it's not working, And this one was slightly better. It was a female doctor, obviously from another country, with the accent and stuff. And I really loved her bedside manner, and she was nice. And she actually recommended an allergy panel, a blood panel, which is like smart, right? So, and she did, but she also told me, oh, take the steroids and stuff like that, and come back and we'll find out what's wrong and stuff. When I came back, it was another doctor from the same clinic, same office, but she had a good bedside manner too. But the thing is, what was so funny was when the blood results came, like the allergy test came out, and I was expecting like mind-blowing results, like, you're allergic to this. And I'm like, I didn't know that. So, but it was kind of funny because she was like enumerating. She said, are you allergic to shellfish? I said, yeah, I already knew that. Are you allergic to shrimp? I said, yes. Are you allergic to cat dander? I said, uh-huh. I went to the hospital for that one. Like, I went to the ER for that one. It was bad. Are you allergic to milk? Oh, yeah. I do have some lactose intolerance, yeah. So basically what the blood test confirmed was what I already knew. And I'm like, oh, dude. So, yeah. Anyway. But she's still good, though, because she said, we're going to rule out any type of infection and stuff, so you're going to be on this type of infection control or whatever that was. Like, she sent a medication. I don't know what it is exactly, but I'll check later when I take it. Anyway, she said, we'll rule this out, but I'm going to send you over to a dermatologist or an allergist if you want. I said, you know what, I think I'll go with a dermatologist because like the allergy panel did nothing. Literally just confirmed to me what I already know to be true, which is I already know I'm allergic to those stuff. So I guess I needed a blood test to confirm it, which is kind of funny though because I did that, and I'm digressing now. I did ancestry. I think I did 2 DNA thingies where they find out your bloodline and stuff. It was kind of funny. It's a waste of money too. It was like I paid like maybe over $90 and stuff for those 2 tests, and they just confirmed like, oh, you come from this country, and I'm like, yeah, so you are 95% probability sure that you came from this country, that you're a Filipino. I'm like, dude, I didn't need a test. I didn't need a not over $90 test to confirm that. I already know that, dude. So it's kind of funny. But apparently I have, which confirmed Chinese ancestry, like 2% Han or something. I think my great-grandmother was Chinese, or maybe my great-great-great. I know someone was Chinese in our bloodline, which was from my dad's side because they keep talking about it. But it's just funny because I wasn't able to trace, which I really wanted, my mom's side as well, where her family ancestry, because she, my grandmother had like violet eyes and stuff like that, and she had like big bones and like different features and stuff. I really was interested where that lineage was, but apparently I just spent over $90 twice to confirm that I'm Filipino. I didn't need a test to do that. I already know that. It's funny. Anyway, so yeah, I'm going to see that dermatologist after I rule out this infection thingy, if this is really an infection or a skin infection or something, and then I'm going to go to a dermatologist. It was kind of funny because I recently moved. So my old CVS, which I've been having problems with that old CVS for a year, but it's okay. I'm like, okay, that's done. So I called them. I said, hey, I'm moving to another CVS. I just recently moved to another area because this old area was like 30 minutes away. That's really far. And it's 45 minutes to an hour with traffic and stuff. I don't want to pick up. I wouldn't make it. It would be closed by that time. So I called around. So I wasted my lunch break, called them. I said, hey, can you transfer over my prescription? Because I think my doctor sent it to this old CVS. Can you transfer it to a new CVS, which is closer to where I currently am residing? And she said, no. You have to talk to your new CVS location or whatever. And it's funny. Oh, I mentioned CVS. Yeah. But I'm still going to use them because they're the only ones that carry my brand that I'm looking for. And I also had bad experience with Walgreens anyway. So they said, yeah, call the new CVS and have them, transfer the prescription. So I called the new CVS and I said, hey, can you please transfer my old my prescription for my old CVS over to this new one so I can pick it up later after work or something? And she was very snotty. And she said I can't do that right now. Maybe we have to wait for an hour or something, or because they're still holding it. And I said, oh, okay, makes sense because I just called them and stuff like that. So basically what happened was when I tried to pick it up, and I should have called beforehand, because I was thinking they were doing their jobs, but apparently not. But she did say, oh, okay, it should be ready in an hour or something like that. It should be ready, just, either call back or just go here and stuff like that. So I did, but it was around 6 or 7 o'clock, and I think they were closing or something. It was close to closing time. And then the woman at the pickup window said, are you sure you called us? I said, yeah, I have I showed her the timestamp, the time that I called, that it was a call that actually happened. And I said, is this the number? Does it end in these numbers? And she said, yes. But apparently she thought that I was imagining things and wasting my lunch break talking to myself, because she said, oh, we never got that call. I said, are you sure? And I showed it to her. She said, no, we never got that call. And I said, but I need the prescription, one of the prescriptions I have to take tonight. I can't wait tomorrow, because she would say, just come back tomorrow. We'll work on it. And I'm like, yeah, they worked on it at all. And anyway, she said, and I was pleading. I said, I really need my prescription. I have to take it by tonight. And one of the medications by tonight. And she said, okay, we will just transfer you to a new CVS, another CVS. I said, is it far? She said, no, it's actually close by. And luckily it's really close by. And I was just so frustrated and I was just tired. It's like the end of the workday, and I don't want to make a fuss. As you all know, I'm Asian, so Asians, we rarely make a fuss. I mean, Asians from Asia. I don't know. It's just a culture, and I'm Filipino too. We rarely ask for the supervisor unless we're really, really mad. So don't piss us off. Because when we get mad, we really get mad. But we're patient people. Anyway, so I called. So I decided to just call the other CVS while I was driving away from that CVS branch. And anyway, and she knew because I was like, it was on full blast, and I'm like calling the CVS and stuff like that. So apparently those two CVSs did not do their jobs at all. They were just passing their jobs to the other location, passing the jobs to the other location. So nothing got done, which is typical, It's just typical of what I've experienced here so far. People just don't know what the other one is doing, and they just pass along whatever their job or something to other people. And I'll talk about that later. So what happened was I called the third CVS, and this guy said, and I said, I pleaded, please, I need my medication, and since you close at 12, is it possible to get it and stuff like that? And he said, okay, I'll work on it. And I said, how long? How many hours before I pick it up? He said, it will be done in 30 minutes. So this dude was able to do the job in 30 minutes. Of course, I didn't go there in 30 minutes. I was walking the dog and eating and stuff. So I went there after 45 minutes. And yeah, apparently it was ready in 45 minutes. And I swear I'm going to stay with this. CVS, not only was the dude, the pharmacist, effective, but he was like eye candy too, So that makes, and that makes a difference. But I think it's mostly likely I like efficient people. I like people that really are good at their jobs, and they really actually do their jobs. I really like that. And which reminds me of the movers that I worked with earlier during the weekend. The dude was so efficient. He was calling me and said, I'll be there in 20 minutes. And then I'm here. And then yes, I have I'm ready. And I like people like that. And I actually gave him a good tip because I appreciate people that actually are efficient. And then I actually told him, you know what, you're really good at your job. You're really efficient. And he said, yeah, I like to make sure that everything's in place, that I'm doing things correctly, and then it's right. He was a Hispanic guy and stuff. And it's funny, his assistant was probably from Mexico. He was a nice dude. I gave him a good tip as well because he was really nice. And apparently he had an Obama hat on and stuff. And I actually talked to him and I said, oh, I really appreciate your hat. And he was like, yeah, but I have the MAGA hat too. I'm like, oh, okay. So he's working for both sides, or apparently he doesn't care. But it's just funny. Anyway, back to the pharmacy and everything else. I think here in the doctors, I think in America, because I work in healthcare, it's really frustrating. Because I worked in home health, and when you're in home health, you literally have to be very proactive. You contact the doctor, you contact the nurse, you contact your supervisor, you contact the family, you contact your patient, and you're very involved in the process, and I'm just used to that. But when one person is not doing their job, it messes up the entire thing. And but I noticed that outside of home health, there's a different approach to everything. I mean, not all home health is efficient, because I have worked in companies that are so disorganized that they actually sent 2 therapists, and I was like, huh? What are you doing here? There's 2 of us here. Who's treating a patient? Who's treating who? And apparently they changed the schedule at the last minute. didn't even call the therapists. And 2 therapists showed up for 1 patient. And it was really frustrating. And to have that, this organization and stuff, and people passing along, it's just horrible. Anyway, so yeah, which really, really reminds me that I really appreciate it when people are very efficient, effective in their job, and when they actually do their job. So since I work in a facility right now, so I'm very proactive when it comes to my patients and stuff. I tell them like, here, yeah. And we had a patient that's going to be discharged back to his home, and there's a lot of moving parts, and he was asking for a physician outside, like to contact him. So he's looking for a specialist. So what I did was I immediately told the nurse, charge nurse, and I told the charge nurse, can you please order a referral for your patient to receive a specialist or consult with a specialist. And then she was like something like that. And I didn't really like. And she's like, I thought it was a yes or something, but I don't know. She was just growling, and I'm like, oh, okay. So I followed up the next day, and apparently she didn't do anything. So I was frustrated. I said, this patient is going home. This patient needs a specialist to see him and stuff like that. Him or her, anyway. Him or her. Anyways, because I can't divulge the information. So what happened was I was so frustrated. I just called the doctor's office because it was like, and I said, I need like assistance and stuff because like what process should I do? I need like a referral from another doctor to see this patient and stuff. And basically the doctor was very nice because he actually called me like in like less than 2 hours, and he said, yeah, I'm going to sign that referral. Just tell the nurse, tell the nurse to write the order and I'll sign it. And I told another nurse because the charge nurse was not there, but apparently no information was relayed because I came back the next day and I said, what happened? Like, did you not receive, I told the charge nurse, did you not receive the message from your colleague? And she said, no, I didn't read no message. And I'm like, okay, so I received a referral from the doctor himself stating that you just need to do the order, write the order as a nurse, so that for referral for a specialist to see your patient. And she didn't know what she told me. She said, you write it. I'm like, what? She said, you write it. I'm like, but I'm not a nurse. And then she said, oh, let the director of nursing write it. I'm like, what? Like, it was frustrating. So I actually talked to the assistant director of nursing, and then he said, oh, you have to tell the social worker. And I did talk to the social worker who told the nurse. But with the nurse telling her that you write it, it's frustrating because, like, getting passed around, apparently that happens a lot in America. And I knew this coming in because I worked for a call center and I worked for American companies for years. So I know that, you escalate the situation and the patient starts from scratch. It's so funny, and it's not funny at the same time. I think this is karma. Anyway, but literally, like, the agent wouldn't write down the notes of what happened, but the good agents will, and this is what happened. I'll refer you to I worked as a supervisor for agents and stuff in a call center, and I really enjoyed it because some were really good at their job. They referred it to the right specialist. They made sure they were very efficient, and I loved them, and I gave them good grades and stuff. And good comments as well. But the ones that were not doing their jobs just kept on passing it along. Like, oh, we're going to pass it to this, and that. And I'm like, dude. And so I know that's how America works. You just stop complaining because you get tired. And apparently there's like when you get called a federal government and stuff, like if you need something or help, it's literally like it would take you days to contact someone. I'm like, dude, that's so not cool. Like, and I tried this on a state level too, like with regards to my license and stuff like that, licenses to practice. It's frustrating. You get passed along and then like you have to rewrite everything. I'm like, this is what happened. This is what I need. And then, okay, call this. And then you call that. And then, oh, call us back. And you just get passed around. And this can happen for weeks. And I kid you not, it happens for months as well. So it's frustrating. And it's like, before I used to get stressed out because like I spent like my lunch break just like holding, like I called like the state board for New Jersey and stuff like that. It was funny. It wasn't funny, but I waited like 30 minutes. I like, oh, please hold and wait until like you get someone. And I waited 30 minutes. And I was so glad when I finally reached voicemail. I kid you not. When I reached the voicemail, it says, the mailbox is full. Call again later. And oh my God, dude. So I spent wasted my time for 30 minutes. But that's what happens. But I really, really appreciate people that, I had a former boss, or actually he worked with the agency that I worked with, but I loved that dude. He was very hands-on. He just was like thinking about ways to make the process better. And it was funny. I really liked him. And I had another boss too. This time he was really my boss, and he owned the company. He started like a home health 20 years ago in Jersey, and then expanded to several states. And he looks like a surfer dude too. He's very cool. He's one of those dudes too that he really finds a way to optimize, organize, and just make things better. Every couple of months, there's always changes and better changes. They're very efficient, and their customer support was really fantastic. And I really loved that company. It's just that that company doesn't exist in the Southwest. So, but they were thinking about it. But I don't know if I'm gonna. And they were saying like, if you want, if you get there, you can be your contact person. You can start the whole thing over there. And I'm like, I don't know. That's such a huge responsibility, and I really just want to do other things, and enjoy my life, because it's hard. But I really do appreciate people that do their jobs, at the very least. And if they're very efficient and they find ways to organize and optimize things, I love them. I really do, because I'm the same way. I'm one of those people. I will like, how can I make this better? What works, what doesn't work? I'm always constantly, changing and making things better and stuff, efficient. But now I'm more like laid back. But before I was so anal, like literally anal. And I think because it came with the culture of the Northeast where everybody's so wound up. But I've learned to relax now, but I still have that work ethic that even if like, I will go to work, whatever it takes, because I really, unlike other people, I don't know, I really enjoy what I do. I enjoy my job. I love it. And I actually got depressed and stuff when I had Corona, because I couldn't go to work. And I was just watching YouTube, and I'm like, dude, this is depressing. I'm one of those people. I just need to be constantly on the move, and I need to do things. And I do chill. I do chill, but I can maybe chill for a day or two. But after that, I have to do something, and always find something to do, whether it be podcasting, writing my books. I wrote like 6 books, dude. So yeah, I really like to do stuff, and I like to be better at something. I like to always learn. So that's just who I am. But it's just apparently not everybody's the same, and it's frustrating. And I just laugh it off, because it's not worth it, to have like a hypertensive episode to lose your marbles over something that, and I just laugh it off. I'm like, okay, I'm just gonna laugh it out, let it slide. And I think that's how you survive America. You just have to let it slide. You literally have to, because you won't, you won't survive here. And I've developed my sense of humor. It's just, I just laugh things off. Sometimes people find it unusual because I laugh things off. Maybe because, I don't know, it's just easier that way to handle. And anyway, thanks for listening. As I mentioned, I'm an author of romantic comedies. So do check out my website, www.homeofgenie.com, HOMEOFGNIE.com, and also email me if you agree with me, and just say in the subject line, "Bisaya in America," and then whatever you want to say, because I use this email for a lot of other podcasts as well. And homeofgenie@gmail.com, www.homeofgenie.com, and I'm also on YouTube. Just find me there as well. And I'm available where all podcasts are available. And if you ever find this in YouTube, please click subscribe. And if you find this on iTunes, subscribe as well. And just subscribe. And because that helps me. And helps me to produce more content. And hopefully you enjoyed this content. Thank you. Bye-bye.